Baby Rebecca was born in hospital, and both her and her mother Isabella received medical help. One might say she's lucky, but in fact it isn't luck at all. It's much more that's brought Rebecca safely into this world. It's a vital, simple, astonishingly effective healthcare support system known as the Rural Transport Network. Together with our partner Virgin Unite, over the last 5 years we've equipped 31 individuals with motorbikes. Working in 26 remote locations across Kenya, they've been bringing mobile health to a population desperately in need. If it weren't for a biker or rider, Isabella may not have made it to hospital to deliver Rebecca.
If Isabella could have not been brought to the hospital for a skilled delivery, she might have lost the baby or her life could have been threatened.
In rural Kenya, a quarter of the population live on $1 a day, with poor access to basic services like water, sanitation, schools or healthcare. In remote villages, the nearest healthcare facility may be a week's walk away, making it impossible for many to receive basic medical care. Boniface was selected by his community to be their health champion. He spends half his time bringing healthcare to his community.
I like doing this work. I saw my people perishing because of lack of knowledge. This is all about life, you know. If you are saving one person, maybe a pregnant mother, you know, you have saved a life. So I'm very happy. This work is all about volunteerism. So it's not payment, but I'm happy to serve my community. As I'm seeing my community is benefiting from this bicycle, I'm proud of it.
To date, the motorbike riders have helped hundreds of thousands of people. They strengthen a government health system which is heavily reliant on volunteer community health workers. In response for their extraordinary work, riders can use their motorbikes for their own entrepreneurial work, allowing them to sustain themselves and their families. Ruth is a widow with children to support. She uses her motorbike to fund her bicycle spare parts business. And, like Boniface, she spends much of her week not just delivering healthcare, but delivering hope and saving lives.
I'm very happy. And the fact that my community call me the motorbike doctor really makes me feel good. Because they usually say, even if things are really low and they cannot access a doctor, we'll just call that rider doctor who is from our village and she'll make sure we get the services we require.
As well as being the first port of call for emergency runs to hospitals, riders help immunise in the community, deliver malaria nets and health education. Each rider serves a vast catchment area, visiting on average 100 households a month, and their effect is being noticed.
Apart from just being a rider, he's also a community health worker, and we give them a lot of information. We take them in for seminars to teach them the basic health care.
Mama na baba. So naimiza tu.
At this facility, we have an old ambulance. Sometimes it breaks down more oftenly. It is never on the road and it cannot go very fast sometimes. It's easier for us to call the rider. So having riders around will really change the health of everybody in the sub-county. Because if just one has given us these good results, imagine if there were many, what would have happened?
The riders' impact reverberates. They have improved sanitation enormously by helping transport tools to harness fresh water sources, as well as helping build latrines throughout villages. Basic healthcare starts here. And the spread of health education limits the spread of disease. Not just waterborne diseases, but also HIV, a major killer in Africa. Many of these mothers and fathers have been brought together through the bikers. They are all HIV positive and are learning how to make sure the next generation is not.
Minegi temo ni mondo These mothers are trying to give birth to babies who don't have the HIV virus. On the 26th of March, we celebrated that out of 45 babies recently delivered, only 2 had the virus. 43 were HIV-free.
After 7 successful years of running the rural transport network, Christian Aid and Virgin Unite are stepping back and transferring the reins to the local health management teams to ensure the service is sustained for many years to come.
As a widow, it really feels like a blessing when I give my time. Even if I give a little from my own pocket, I feel it's a blessing and a good thing.
So I'm part of that community and I will remain in that community, so I have to serve my community the rest of my life.
We want to continue to bring life and health to Kenya.
I'm needed. Yeah.